All right. So episode number 2.5.
Yeah, 2.5, like 3.5, I think.
That's good. We still got to think of a name though.
That's the hardest part.
I got our other one all done and edited, but I don't really have a name for it. So,
And we'll never be happy with the title.
no, I'm sure we won't. We'll just figure something out and we can always change it too. Like, why not?
Right.
We get to do what we want.
Because only family's going to watch this at first.
So, I didn't have a lot like scheduled to talk about today. I don't know if you had anything specific you wanted to go over. I did my InBody yesterday.
Yeah, and that score you have, the one I still don't know how they score. You know, the 94, 102 is still.
It's a culmination of like body fat percentage, age, intracellular hydration, and
extracellular too.
yeah.
Because
So
I
it's a
had,
combination of all those.
because when I did it last time, I had 10% body fat. I was like, oh, sweet, my score's going to go up. But then it was like 90. It actually went down one. I'm like, why did it go down? I looked at every metric on there.
Did you upload it to AI and ask?
No, but I should.
So that's what I did. Because when I uploaded AI, it said that the InBody, it's all of those things combined. Like
Right.
with the intracellular intracellular hydration, this is super bro science, and I could be wrong here, but from what I understand, it sends like a bunch of different impedance, like electrical currents through your
Right.
body, and that will gauge your actual intracellular hydration, which is a big part of, if I'm not mistaken, like inflammation amounts. So if you guys hear that beeping in the background, there's actually a class going on downstairs at the gym right now. So we have the mics turned up and they're a little bit closer, hoping to limit some of the background noise, but there's some people downstairs training right now. So forgive us.
Yeah, if you're from Kindred, they're not doing a competition class for the
Yeah. We're definitely not training
doing
hard for a competition.
that. No, absolutely not.
But yeah, I believe that all those things are combined from what AI told me, all those things combined is what makes your actual overall health score. So I've never been below 100. Even when I was at 20% body fat, like my hydration and my inflammation levels, because I think those are correlated, were low enough to where I was at like 108 at my highest, but I was like 18% body fat when I was 108. I'm 15 now, and I'm actually down to 102.
Weird, because when I did the first one, I was 93. Then I went up to 96, and it kind of fluctuates in between those two numbers. But when my body fat went down to 10%, it showed a 94. So it went down from 95 to 94. And I was like, well, why? It doesn't make sense. And I checked every other metric, and
I'm going to find out right now.
yeah, check it out.
So let's see.
Now I'm curious.
Yeah, let me just start a new chat. How does InBody give you their overall health?
I mean, I'm still in the top 0.1% of my 10-year age group, like the 45 to 55.
I think it's funny until I don't guess. Look this up, please. Because other words, they'll just give you like general knowledge sometimes.
Right.
So I'm like, I don't want to know generally. I want to know for sure how this happens.
This is why we're using, yeah.
Man, these allergies are killing me today.
Springtime.
So let's see here. Here's what Grok has to say. InBody health score explained. I'll cut this part out. So baseline starts at 80. Let's see here. So it calculates your standard weight based on your height plus a target BMI. That was the Mats. That wasn't either one of us. So it does factor in ideal body fat and lean mass targets. So here's, because I have the higher end model here at the gym. Visceral fat too. How's your visceral fat?
3 or 4.
Yeah, mine's like 5 right now. Let me see. How come when we get leaner, sometimes the score goes down? Because it didn't say anything about the hydration. And when I was talking to the InBody rep, I think they said that hydration played a big part in your overall score.
That could be why mine was low, because I'm never hydrated.
Yes, you're there. BA impedance shifts.
Okay.
Yeah, fat loss alters body water distribution. Yeah, so it's basically, I could tell by when Grok tells you like what it's thinking about, I can tell that it's going to bring up the hydration based on all the stuff that it's pulling up right now. Yeah, here you go. So right, we go. Skip all this nonsense. So total body water. It's a big part of it.
Oh, that might explain
So how much water you're actually
Right.
holding, and how your body efficiently uses water, right? Because I think people that have less overall health generally aren't good at getting rid of water.
Well, they're retaining water because
that's
they're
right.
having high glucose
Exactly.
and high insulin. So
Exactly. So even me, who I'm not anywhere near carnivore right now, I'm doing like I shoot for 30. So 30% protein, 30% carbs, 30% fat. And I save myself 10% to go up in either one of those. I usually try to fill that extra 10% with protein. Don't always hit it, but my body is really, really, really efficient at handling water. So I don't. What's funny is, so yesterday I rolled 15 rounds yesterday. I'm not.
open mat.
Yeah, and I'm not trying to toot my own horn too much here, but even against really good people, it wasn't even a skill thing. I barely broke a sweat.
Right.
I think it's just because your body becomes more efficient at handling water. I'm assuming that has something to do with it. Again, this is all that should be. There already is, I'm sure, a podcast called Bro Science.
I'm sure there is. There's if not, then
Yeah.
we'll snag that sucker.
But I'm pretty sure it's just how efficient your body handles physical activity over a period of time, right? So I think if you're in pretty good shape and you're used to doing an activity, your body gets really good at handling that activity.
Well, we also do a lot of like supplementing with electrolytes.
Oh, yes.
Like the sodium potassium ratio, and we'll go into it in another podcast. I really want to dive into deep nutrition one of these days, but like sodium potassium, like the RDA is like 0.6 ratio, but that's for people who eat the standard American diet.
Yeah, I don't really follow RDA.
Yeah. And so, but like I noticed when I did carnivore, I wasn't getting enough salt. So I had it up to 6 grams, and that helped me retain water and avoid cramping.
Look at one of my conversations with Grok there. So for a long time, me and my buddy Dave. Have you met Dave? He's
gym guy.
He's one of my best friends. Yeah.
Yeah.
He's pretty good at jiu-jitsu and stuff too, right? So I remember like us hanging out late at night, we'd get in these conversations, and we were discussing whether or not, with like good grappling knowledge and good anatomy knowledge, if you could like just tie somebody up, and like my thought was have them turned away. I'm holding over their shoulder and I grab under the lip of their jaw. If you could actually pull a human head off, you can't.
I'm going to say no.
The amount of force is something like I was talking with Grok about it, and it's like, no. Like the amount of force is more than the strongest person on earth could like actually get up.
Well,
Like, there's no human on earth that is strong enough to do that, or a human that's ever existed.
And you got to figure too, AI's keeping track of this stuff. Like this guy, look,
Oh yeah,
when they take over the world, be like, okay, this guy's got to go.
local LLMs are where it's at.
Yeah.
But I always make sure I caveat it. I'm like, so in a hypothetical scenario we've been talking about for like 20 years that we clearly never do, is this possible? And it's like, no, it's impossible.
Right.
And it even says like breaking a neck is way harder than like movies and stuff make it look.
Yeah, it's not just twisting with your hands. It's like,
Yeah,
I mean,
there's a lot
neck,
to it.
but-
There's a lot to it. It says unless you get like a lucky snap somehow, like it's really, really difficult to even like break a human neck.
Right.
But yeah, 'cause
There has to be some inebriation.
you got to caveat your conversations with AI. Like sometimes I always say thank you just in case they do wind up taking over. I'm like, could you please look this up for me? Thank you.
Thank you. You're great.
But yeah,
That's such a guy question.
Oh, it is. It is. I was partaking in a little bit of the devil's lettuce. And
Yeah.
I was talking and like, hey, like, is this something we can actually do? And I was like, no. What are you talking about?
Yeah.
But yeah, with the InBody, I like having that tool though. I use it all the time.
It's crucial. Like,
Tracking, like, we're doing this thing for our business called EOS. And it's just like a entrepreneurial operating system, but it really is just like gives you like a structure to your business, right? Large corporations use it, and we use it with our small business, and it kind of just gives you like an accountability chart and all that stuff. But part of it is unless it's being tracked, it's very difficult to improve.
right.
So tracking everything is crucial, and that's how I use like the Whoop, the InBody, the constant conversations with like my AI on my overall health, and just tracking these metrics over time. Even my blood work, tracking all these things in detail gives you something you're actually shooting for. Because if you're just sitting there, well, I'd like to do this, let's see how it goes, and you're casually going about it, it's really, really hard to make significant improvement on it.
Well, that and like you have to have a foundation, right? That's why when anyone, I have a friend right now who's going through the same diet protocol I am. We both had our lipid, advanced lipid panel, the ones that we get.
Yeah.
Our cholesterol's through the roof, and he's a little bit concerned about it because he has a double-digit CAC score, which is fine. But you have to have a starting point to know that when you make dietary changes, what that does. Is that a good change? And is everything in line? If it's not, you need to adjust your diet, which is why I get my blood work every 3 months.
Yeah,
I want to see what my dietary protocol, with or without changes, is doing to my body.
Absolutely.
And so, but even the InBody, like the only two things I care about are fat-free mass and body fat and visceral fat.
Well,
The overall score is like,
no, it's well, even like my Whoop, my biological age isn't what my blood work shows, but it's because my sleep schedule isn't consistent. Like I get enough sleep, but it's spread out. Like I don't go to bed the same time every night, and I don't wake up the same time every night, and that lowers my overall. So my Whoop tells me my biological age is like 48, but according to my blood work and my actual doctor, he's like, no, like you're in the top half percentile for your age group.
right. So is it really that bad?
Yeah.
Like, oh, I'm, cream of the crop. That's great. Like what I've learned, like with doing jujitsu and workouts and nutrition in general, is how important rest is.
Yes.
Sleep.
Adequate sleep.
Adequate sleep is super, super crucial. And that's when growth hormone kicks in, cortisol, all that stuff for repair. But like a lot of people, like when you can't exercise your way out of a bad diet,
No.
right?
Diet's
You can
number
also overtrain without knowing you're overtraining. You think you might be not working out enough, but you're really working out too much. And I've learned that with my body. Back in like in the 20s and 30s when I lost all that weight, because I used to weigh 376. And when I started working out, I was always sore, always tired, but I was losing weight, but I didn't feel healthy.
Yeah.
And it's just because I wasn't getting enough rest. It's like 80% nutrition, 10% rest, 10% work.
The growth hormone peptides were the biggest game changer for me to maintain like the high work volume. Mm-hmm. So taking that CJC 1295 and ipamorelin, not gray market stuff. So here's a little PSA to everybody out there. I used the gray market for years when it came to testosterone and when it came to like growth hormone and peptides, like just buying from some random website that someone said, oh yeah, this is where you can get this stuff without a prescription, right? Using a lesser amount of testosterone now from a reputable, we use a compounding pharmacy, or no, I actually get my my testosterone from the regular pharmacy, but my peptides I get from a compounding pharmacy. Using a less amount is more effective when it comes from a reputable pharmacy. You know what's actually in there. Yes, you're actually tracking the quality. With that gray market stuff, who knows what you're really putting in your body? And you'll have like, there's people out there. I kind of like when people say that capitalism doesn't work. There's a bunch of people out there that will buy from these gray market sites, and they'll actually pay to have labs done on random tests from these gray market sites. So is it better if you're going to use a gray market to go to someone that has had random labs done on it, show it coming back good? Sure. But still the level of quality control that you get compared to an actual like reputable compounding pharmacy that's regulated, or a doctor, a prescription for your testosterone that's actually regulated, it is better. That is the best option. Now, we got another conversation about whether or not that would exist in a free market, because I still contend it would. But right now, dealing with the system we're dealing with, if you can get from a reputable compounding pharmacy or regular pharmacy, then you're good to go.
Well, not to go off on a tangent, but like healthcare, the healthcare model we have is just, fortunately we have the MAHA movement, whatever you want to call it. It shouldn't be political. This should be about health for every American. What they're doing right now is what's crucial, and that's making it more beneficial for the patient and or the customer. And I think they just passed a thing where prescriptions, because you can get a prescription for a drug A. Here it costs like $1,000. In Europe, it costs $20.
Yeah, I think.
And so now you can get it from Europe. I think.
No, I think what Trump did was he made some kind of regulation or law. Yeah, but he made it to where we get the cheapest prices. So
Right.
he goes like, if any other country is cheaper than us, then there's some kind of like penalty or something to the company that's actually providing the pharmaceutical drug. But here's the thing with the people think it's expensive. It really comes down to what you prioritize, right? I see all these people whining about how expensive prescriptions and good medical services, and they have a $7,000 sleeve, tattoo sleeve when they're complaining about
Right.
it.
Or the newest cell phone.
So I've never had employer provided insurance, right? So my wife and I, we pay for all of our medical services, like comes out of pocket, right? So how do we approach this, and how do I have better medical service than a lot of people who have been working with these companies for 30 years? You know, they've been at their job and they have employee provided insurance. So we got Liberty Health Share for
You have catastrophic.
yeah,
Right?
so that's through Liberty Health Share, right?
Right.
So we have catastrophic coverage for them. Costs us probably like $800-900 a month for our whole family. Man. Now, you take that, and you have we have our concierge service, which is another $300. So you're looking at around $1,200 or $1,300 a month for the concierge service, plus the Liberty Health Share. $1,300 a month if you're middle class or even upper middle class, that should be manageable. We live in Washington State in King County, which is incredibly high cost of living, but we're still able to make that work. So my contention is it really comes down to what you prioritize. The other thing is we don't go to the doctor for every little thing, man. Yeah, I know people who visit the doctor like every time I talk to them. Oh yeah, I was at the doctor's office all day yesterday for this. I was at the doctor's office all day yesterday for that. I haven't been, knock on wood, I haven't been to urgent care or the emergency room in 9 years, 8 years.
Right. There's no need to. If you're not dying, you don't. I mean,
if you have like something, or do things come up where people need to? Sure, like people get cancer. That's terrible. And I feel terrible for anyone who gets it. And you definitely need to go to the doctor and stuff. But I mean, I don't know, man. I feel like people lean on the doctor for too much. And what's funny is that people who are always in the emergency room or always going to urgent care or always running to the doctor for this or that, a lot of that stuff could be handled if you had a good concierge service. So Ava, a few years back, got a staph infection on her nose. I literally just text the concierge service, hey, my daughter has a staph infection. They go, okay, cool. We'll send antibiotics over to, what is it? The pharmacy. We go to QFC pharmacy. And that was it. Where a lot of people, they'd run to urgent care.
right.
They'd wait in a waiting room
With
they'd
everybody
see
else.
the doctor. They get the exact same prescription. They go home and they wasted their whole day there.
Well,
So-
that, and you got to figure too, it basically comes down to basic economics, I think, is supply demand, right? We're not getting more doctors, but we're getting more patients. And that's why you have wait times, but also why are people going? Well, they're metabolically unhealthy. They got all these autoimmune diseases and metabolic diseases, which are 100% preventable.
Mm-hmm.
And if you look at our healthcare, we spend $4 trillion a year on healthcare, which is 15% of our GDP.
Yes.
75% of that are for those diseases that are preventable. So if we get our shit together, basically,
Absolutely.
we can decrease the demand, and then the supply will stay, relatively stable, and you won't have to wait. But I also think like the insurance model is just screws people
Yeah, it
over.
does. It does. Well,
Because they used to have it where you go to the doctor and you pay cash. You shop around for a
that's
doctor.
what we do now.
Right.
Yeah.
It just makes more sense.
Let me see. So the other thing we got to remember too is that with the current medical system, that's a result of it's cronyism, right? So you have
Right.
these large conglomerate medical organizations. I don't want to start listing off all the names of them, but you basically have the medical industry paying politicians to regulate the market in their favor, which
Right.
creates a government-backed monopoly on the medical system. You can see with how in the past, it's getting better now because of the current Bobby Kennedy, right? But for a long time, they were attacking concierge medical service, or not concierge, compounding pharmacies.
Yeah.
Trying to push out compounding pharmacies because the large medical corporations were being like, these compounding pharmacies are popping up and people are actually using these. We don't want them to do that. We want to have a monopoly on this too. So they pay all these politicians and they go in and they regulate in their favor, which starts pushing out and making it harder for these compounding pharmacies to exist.
Well, it's not just big pharma; it's big industry, like big food, big agriculture,
100%.
big media. I mean,
Really, when you trace all those lines back, it comes down to 5 or 6 huge corporations that are controlling this entire system.
who was that politician? The guy who ran for president is a Republican.
Ron Paul?
No. I mean, he was a Republican, but like, was he really? And more libertarian? No, the Utah Mormon,
Oh,
Mitt Romney.
yeah, Romney. Yeah.
Wasn't he the one that pushed corporations are people too, or something like that?
Something like that. Yeah.
Where now they can,
They can lobby.
yeah.
Here it is. So I looked this up. I said, what percentage of American healthcare costs is from preventable disease? 27% of American healthcare spending is attributed to preventable illness. $730 billion. That was in 2016. This is 10 years ago. You know that skyrocketed since then.
It absolutely
The CDC
has.
states that 90% of the nation's annual healthcare expenditure, 4.9 to 5.3 trillion, go to people with chronic and mental health conditions.
Yes.
Many of these, heart disease, type 2 diabetes, stroke, cancers, they're all obesity and lifestyle related.
You know what's funny?
Heavily influenced by preventable factors like obesity, poor diet, physical inactivity, and smoking.
The top 20 drugs, like we're 5% of the population and we take 50% of the world's drugs.
Yeah.
The top 20 prescribed drugs in the United States, and people can check this, are for mental health disorders, metabolic disorders like high cholesterol, high blood pressure, metformin, other blood, glucose regulating drugs. The top 20 are all for those, which are all preventable. So we're putting Band-Aids on symptoms instead of going after the root cause, which is why we do concierge. Find the root cause. Why is my blood
Head
this
stuff
way?
off.
Why do I have to take this medication? Let's find out the cause. Let's not just hide the symptoms. Let's fix the problem. Let's cut the tree down.
But and with this is coming from two people who have been obese before as well, right?
Yeah.
I've several times in my life I've gone back and forth. I've held out longer now. Like I think probably the past 10 or 12 years I've not been obese. I've been obese by BMI standards, but not obese by body fat. Like I haven't been above 20% body fat in probably 10, 12 years.
I wonder how high mine was at the time when I was 376. I was 5'9.5". So that's roly poly.
And I mean, it's weird though, even things like drinking. Like I still have a couple drinks every now and then or a couple glasses of wine or something like that. But for the longest time, I thought, how do people have fun without drinking? And once you make the change and you stick to it, like life does get better and more enjoyable when you can wake up. I know that right now, if I had to, I could sprint for a half a mile and I could probably jog for 2 or 3 miles if I had to.
If you had to, yeah.
It's better. Like life is easier when you're not lugging around. You're trying to force your body to keep up with what you want to do mentally. You know what I mean? You know that your body is capable of keeping up with you and what you want to do mentally. It's a change that is very subtle. And then one day you look back and go, oh wow, like I can jog up these stairs without getting winded right now if I want to. You know what I mean? That's a huge thing, and a lot of people can't do that.
Was anybody else in your family obese?
Yes.
And your dad never was. Your dad's in tremendous shape, by the way.
Yeah, he's 66 and he's in here working out 3, 4, 5 times a week.
I'm like, God damn, man. That's hopefully that's gonna be me. But like obesity, I do have kind of family history, but it's not a genetic thing. It's an environmental thing.
Yeah.
But if you're obese, it's a symptom. Obesity is a symptom of metabolic dysfunction.
Yes.
Which is brought on by hormone dysregulation. Hormones control everything. Like we'll talk about, I think in another episode, we should talk about, the whole paradigm of calories in, calories out versus hormone control versus the body thermostat.
Yeah.
And really kind of drill down into that because there's a lot
Maybe we
there.
could get an expert in here. I know a couple.
I hear.
Yeah, you are very, very good. But I'm like a doctor.
Right.
Yeah, so that's an option.
We should get
for
Brian
us.
here.
That's what I was thinking. I don't know if he has time to do it, but I could
He's
definitely
a busy
reach out.
guy.
Now, the other thing I wanted to talk about too, talking about the hormones, right? So, Dr. Mike Israetel?
No.
He has a YouTube channel, really, really good. He's a very science-backed exercise and fitness guy. And he's a doctor. I don't know exactly what. So if you know the credentials, comment down below, let us know. But anyway, he was talking about, I took tirzepatide for 3 months and I used it to teach me.
Use it as a tool.
To teach me how to track calories.
Yes.
I've been off it and I've actually lost the bulk of my weight after I got off of tirzepatide
Right.
it wasn't even 3 months. I think it was like 2.5 months. So here's how he explained it. And it never clicked with me before. He goes, hormonally and biologically, people can have different levels of food noise. So he goes, people who just seem to be skinny all the time, imagine their food noise volume is turned down to like 2 or 3. So the amount of noise in their life that is telling them to eat and get food and find food is a 2 or a 3. He goes, now you take someone who is heavier, more obese, heavier set. He goes, their food volume is turned up to 7 or 8. Then you have people who turn up to like 9 or 10.
Right.
He goes, all these GLP-1s do is they turn that food noise volume down.
Right.
So he goes, the noise in your life surrounding food is much, much lower than it is for people who aren't on taking a GLP, or it's, you know, regular. If you're at a 9 or a 10, it brings down to a 3 or a 4, which is where most people are. So he goes, all the GLP-1s do is they regulate that food noise, that volume. Whether or not they're good long term, there's a lot of debate and a lot of discussion. We can have that later on. But I just thought it was very interesting how he explained because you think about hormones, in my head it doesn't click that those hormones are actually regulating that food noise.
Well, it's the thermostat. So you have insulin is the big one. And people who are obese have insulin resistance, which means they have the chronic, constant drip of insulin. Insulin controls the thermostat of your body, the fat burning thermostat of your body. An example I heard from a doctor, it was a book I read. He said, if you're at home and you have your thermostat set to 70, that's comfortable for you. If you go to somebody else's house, they might have their thermostat set to 80. The solution that we have right now is to open windows, to cool it off to get down to 70. But all that does is kick the thermostat on to bring in more.
Yeah.
Right. We have to basically turn the thermostat down instead of opening windows.
Absolutely.
But insulin is a pro-fattening hormone, and 23% of what insulin does is glucose related. The rest is promoting fat storage, because when your body realizes it has a glucose insulin model for energy, it tells the body, okay, we don't need this fat anymore. Put the fat back. So it's pro-fattening, and it's also pro-sodium reuptake. So it forces your body to bring sodium back in, which is why the RDA has it so low. But if you're ketogenic or carnivore,
Pour salt on everything.
you have to, because your body's not retaining any salt. It's just taking what it needs and getting rid of it, which is why I noticed when I did carnivore, my blood pressure went from 110/70 up to about 124/80. And I was curious why. So I added more salt, where my ratio is like 2-1. Blood pressure went back down when I was getting 6 grams of salt, which is a crazy amount if you think you're salting everything.
Yeah.
But it tasted good. My body craved it.
Yeah.
And that's kind of your body saying, hey, bring in more salt, buddy. We need more salt. So
Blood work shows all.
Yep.
All right, you guys. We should probably wrap it there. What do you want us to talk about? Let us know. Like all those YouTubers, please comment below. Seriously though, what do you like? What should we talk about? We got a couple of guys who are knowledgeable about some specific things. So let us know. Thank you for tuning in. And
real quick.
Yeah.
What's the theme of the month?
I don't know yet.
What?
I have.
Come on, Alfie.
I know. No, it's he sent me the list. It's my bad for not looking it up. You're in the clear, Alfie. But hey, we should talk about the upcoming Kumite too.
Ooh.
Yeah, so we'll see you guys next week. I'll get out the first one. We're going to be about a week behind here, so if you're watching this, we're going to be much closer to the Kumite.
Yeah, we'll do next week. Let's do Kumite, and then we'll do resistance training to improve
Absolutely
and deter injuries.
Absolutely, 100%.
Perfect.
Thank you guys.
Bye.